Hello, everyone. It's Sheriff Jeff Smith and myself here today, December 21st, to give you an update on what's happening in Montgomery County. Obviously, the big point of emphasis today is the latest COVID numbers and giving everybody the information that we have. This was, if you recall, we've just to review what the weeks have been going back a couple months. We started out 7 in a week. Then we went to 15, 28, 78, 90, then 128, which was we thought was a big number. And then last week kind of leveled out a little bit at 131, and we have another big jump in positive cases this week. With 218, we've had a couple days where we've had the most cases in a day. So we're definitely seeing another jump with the numbers, and just wanted to throw that out there. Along with the fact that the number of people that are being quarantined and monitored is also going up. That's now at 520. Last week it was at 445. We did have one more fatality, additional 5 in medical care, 14 in medical care. I believe 2 of those are in the ICU. Having positive cases really everywhere within the community, east, west, different schools, have been doing everything they can to stay open. It's been a real challenge. But we're seeing a large volume, no doubt about it. And with the holidays coming up, I certainly expect this trend to continue, and encourage people to, try to limit your gatherings as much as you can, and try to make those smart decisions that we've been emphasizing along the way. But we're at a point now where it's certainly here in a big way. Public health, as far as the tracing and tracking going, they're working as hard as they can. It's around the clock. It's 24/7 basically. But even so, with these numbers are so large that they're about 3 to 5 days behind. You add that in with lags in testing because of the volume. It's a really, really tough situation to manage. So they ask that I emphasize, people that, if you're getting a test, you have symptoms, a lot of the things that we've been talking about, do your part, try to stay home, and do what you can. But we all know that, we have Christmas coming up this week, and, certainly a lot going on, but now's the time where we should really try to dig in and each person do what they can to try to help with the situation. Right now, as I understand, the hospital's in good shape. People are getting and have the ability to get the treatment they need, which has always been a concern of mine. But overall, the Mohawk Valley, as far as regions within the state, we've been singled out a little bit by the governor's office as an area he's watching. We're still not in a zone, which again, I do think that will happen, especially with what we're seeing with another big jump this week, going from 131 in a week to 218. So that's the news, and just wanted to share that and get it out there. Sheriff, how's your week been?
Not too bad, same as it's been happening on a regular basis, pause complaints, but I couldn't agree with you more, Executive. I mean, we want to celebrate over the holidays, but we really got to buckle down here because the numbers are disturbing, and communicating with the school districts and law enforcement in the county. We've had some officers that have been close to being affected, and fire departments, and, we really got to take care of our own here so that we can get through this.
Yeah, it's been tough on a lot of the first responders. I mean, I know I even seen it on my block. There was someone that had to be taken to the hospital, and it's full PPE, and it's almost surreal to see out your front window. You know that it's going on, but when you see that, it certainly hits close to home, and
it feels like it's closing in on us.
Yeah,
and we've been very lucky, and knock on wood, our agency has been well, but when you're out there serving the public, you certainly don't want your first responders to struggle as well, because it would only take one positive case to wipe out many staff, and then we're in trouble.
Well, we even saw that in the snowstorm a little bit. I know DOT had to shift some people around, which affected our state roadways, even though within the county we've had some local towns that had to make some adjustments related to COVID. So regardless of, we know that people are beyond frustrated and just sick and tired of hearing this. But this is the world we're living in. We're still living in through a pandemic, and the good news is, with all these positive cases, the amount of people that have passed is relatively speaking, we're doing okay, and people are most of the time are making it through it. And I know some people take it more serious or less serious, but it's impacting everything. And we go now even looking ahead we might get a rainstorm around Christmas, which could lead to some flooding issues. And, if anything, it becomes sometimes a manpower issue when you have people out. And so we're going to try to deal with it and do the best we can. Just urge people to try to follow the protocols. And, if you're sick, if you're, have a test out because you were a close contact, really limit your contacts and do what you got to do there. That'd be a big help. And, think of all the people that, are out there working. And, I think about our public health department. You can see that they're tired. I mean, there's no doubt about it. And, it just has to everybody has to stay on edge. But so again, we'll get through it, but there's a lot going on, and we're trying to manage it the best we can and give people the information. So how are we doing on questions today, Morgan?
There's a couple. Jeff, I'm not sure if this has to do with the, you guys were doing like donations with the sheriff's office. Someone just wrote that they might have some new items to give away to the needy. Is that still possible?
Yeah, I would say it's always possible. So the items that we were giving away, the school districts identified families that were in
Okay.
need, and that's what helped us. Like, we don't have a list of people at our fingertips of who needs items. I would say have them contact Salvation Army, Catholic Charities,
Maybe Fulmont.
Fulmont, their local school district, because they always have people that are right in need, and the OFA too, Office for Aging.
Why are people allowed to walk around in stores without wearing a mask?
Well, they're technically not supposed to. I think it's more of an enforcement issue, and that's where the pause complaint
Yeah.
hotline comes in, and we try to do our best. I mean, we've been battling the mask wearing for months now, and
And the pause complaints are difficult sometimes
Yeah.
because we'll get one, right, that there was a gentleman in aisle 5 who wasn't wearing his
Yeah.
mask properly. But the pause complaints comes
yeah,
maybe an hour or two after
Yep.
the fact. So when we get a pause complaint, we send a deputy to that store or we communicate with them and let them know about the pause complaint. We look into it the best we can and we encourage them to follow the rules for the safety of everyone involved, just like we've talked about here numerous times.
When there is a positive case within the schools, are the schools being thoroughly disinfected?
yeah. I mean, I know the schools have to follow strict protocols there, and I have not seen anything to the contrary. And we've had 2 conference calls this week with the superintendents that Sarah and I have been involved with, and it's a tough situation. I mean, they're trying to, on one hand, you want to do everything you can to keep the kids in schools because there's a lot of kids in this community that really that's the best place they could be, and the numbers around the state have proven that the schools are safe. We haven't seen that spread in the schools, but then on the other hand, you see the challenges we're having with tracking, tracing, and testing, and the volume of the numbers. So it's a my big concern right now as we sit is we know people are going to get together over the holidays and Christmas, and we know what's going to happen. So my concern is that things are going to get worse before they get better, and that's going to affect everything. It's going to affect jobs, services, schools, and but yeah, I mean there's protocols in place, and I I feel confident that they're following.
Yeah, I'm sure they're
Yeah.
doing everything they can.
Last week's quarantine number was 650, not 445.
Oh, excuse me. Oh, I'm sorry. I looked at the wrong one.
You would expect that number to rise with more positive cases. Is the drop indicative of understaffing at public health? Doesn't this number imply that there are likely a large number of people that should be quarantined that are not?
And that's why we're saying, I mean, yeah, I mean, and I apologize about that. I had the wrong one in front of me. They're right, 650 to 520. I'd have to ask specifically, why they see that change. But if I had to guess, yeah, I mean, the volume of work is tremendous, and we've handed off, as much as we can with state help and things of that nature. It's both the testing and the tracking and tracing, and yeah, I just talking to them right now. They're 3 to 5 days behind, and quite frankly, this is what you're seeing around the state. This isn't just unique to the county, and they're just trying to work as fast as they can, and that's why the last couple of weeks I've really been emphasizing that the public has to do their thing. Check out the stuff that we've put up about isolating and quarantining and doing the best you can. And if you have a test out, automatically assume that you should stay home and do the best you can. Use common sense.
Why does the Mohawk Valley have one of the highest infection rates other than the Finger Lakes? Areas all around us are much lower. Is it non-compliance only?
I mean, the biggest thing right now for me is at the point we're at right now, it's community spread. So the more gatherings there are, and that's where you're seeing a lot of it, you're going to see numbers like this. So,
Population has to play into it as well, right?
Yeah.
So the larger population that you have, the more numbers you have for that equation.
Yeah, it's, when you look, and I think regions are unique. There's certain differences, between them. But right now, I think it's certainly, it would be a guess. I mean, right now, it's not like you're finding, like it's been for us for a long time, where you have stuff that you can track and you're tracing it back to a very specific source. I mean, there's a lot of community spread going on right now, and I would attribute it more to that. And, from what I've seen, it's been a lot of the private gatherings. It hasn't been the schools, it has been workplaces that, places that are following the protocols aren't having major issues, but it's everybody gets home and feels comfortable, and that's where we're seeing it. So if I had to give a reason, that'd be the reason, and I would say maybe we're engaging a little bit more than some other regions, but to have a definitive answer right now is difficult.
Are COVID-19 positive patients sent home from the hospital to recover without testing negative first?
I think it would depend on the particular situation, but I'm not sure. I think, in just thinking anecdotally with one of the situations, I think they can be sent home while they're positive if they don't need to be in the hospital. And that's the point, is to make sure you have the capacity in the hospital. So if somebody's stable and can go home, I imagine they could be transported. But that's, again, I don't have, that's unofficial from the hospital, but if that would be my guess.
And if they are, that's the importance of quarantine and following the instructions.
Yeah, exactly.
Right.
If you have a basket of food items, can you drop it off to the sheriff's office to get to a family in need?
We will do our best. Again, one of the things Fulmont and Catholic Charities run, and the Office for Aging, all three of them run food pantries. So that'd be the best place for it. But if somebody happens to bring something here, I will reach out to one of those places and find a family in need and try to get it there. It's just easier if it goes to them directly.
You also got the Amen Soup Kitchen.
Amen Soup Kitchen.
Do you think our higher rate has anything to do with the fact that we do not have drive-through open testing that anyone can go to?
No, I mean, I think we have a higher rate because that's what we're seeing. I mean, we've had a pretty good judge on, along the way and being able to tell what's going on. I will tell you that within the region, we're testing 5, 6, 7 times what the recommended levels are. And we get that stat from our control room call Monday, Wednesdays, and Fridays. So there's a lot of testing going on. It can be inconvenient and it can be delayed, and the volume has put a real hinder on things. But I think with the amount of testing that's going on, we're getting a very good gauge of what's going on in the community, and that is that there's pretty widespread community spread right now. And I think that's the reason why we're seeing what we're seeing. I don't think, the amount of testing or how we're testing really, wouldn't take away from that fact.
When someone goes for a COVID-19 test, are they told to quarantine at least until the results come back?
Yeah, I mean, that's what we're asking people to do. We're sitting here today saying, if there was a reason for you to get a test, you have symptoms or you're a close contact, then yes, you really should do that. That would be a big help, because then, if you were around people during that time, and you do test positive, then that's, the wheel keeps on turning.
Has St. Mary's provided the county with any updates on distribution of the vaccine to the first people scheduled to receive it? Medical professionals, people in senior living, etc.
We have a call coming up with them. I don't want to speak for them, but my understanding is it's being distributed according to plan. But that's not necessarily a county responsibility, but we can provide more of an update on that next week.
How far behind is the contract tracing?
3 to 5 days. And we're not happy about it. The staff is working as hard as they can. It's a tough situation, and that's with bringing in state help for a lot of other things. We do have a new nurse that's going to be coming on. We did add another position, and trying to come up with ways to do it. But yeah, it's definitely behind. It's
county exec, it's like getting 3 inches of snow and ice.
Yes.
Right. The highway guys can only do so much.
Mm-hmm.
And
Yes.
Are we happy that the roads weren't crystal clear? No, nobody is. But when the call volume and things like this happen, and at this rate, you gotta realize that people can only do so much and they're working around the clock to try to do the best they
They
can.
certainly are, and that's where we need also the community to buy in and try to help
Right.
be a part of the solution.
And be understanding.
Yeah, it's going to be a tough month or two coming up. I mean, if there's 2 weeks after until we see the impact of the Christmas holiday season, I mean, you're talking mid-January. Maybe maybe at that point we start to see things come back down again and can ease into spring, and hopefully this will die down. But
I mean, they're certainly not coming to work saying, we're not gonna do contract tracing.
oh,
today.
that's
They wanna get it accomplished as much as.
yeah, and honestly, you can see it in their faces. I mean, they're tired, and there's a lot of angry people right now. I mean, imagine being quarantined right before the holiday when you got to go out and get the food for the dinner, and even if you're just having your immediate family, there's a lot of stuff that you forgot this at the store, and you can't go. I mean, so a lot of that anger is being taken out on them, and it's tough. So yeah, they're 3 to 5 days behind. It stinks, and we're doing everything we can to get caught up.
How high does the infection rate have to go to be before things start shutting down?
Well, it's not what we've learned in the last couple of weeks for the governor. It's not about the infection rate. It's about your capacity in the hospitals. If we were just going by infection rates, we should be in a zone by now. So what we're looking at is the ability to treat people who get sick and the amount of people that are sick. So that has given us the ability to keep the economy open. With that said, do I believe that we'll end up in a zone? Probably, and I do think it probably would be soon. But as long as the areas within the region have the capacity to treat sick people, I think the governor's going to not go so hard on the restrictions. And I think that shows that we've learned along the way. I think it's certainly a fraction of what we're dealing with right now in the beginning, and we were in a complete shutdown. And now we just had 218 cases in 1 week.
Took us months to get there.
Yeah.
Yeah.
And everything's pretty much, going on. So as normal. So, yeah.
Why isn't the county asking the state for more help with tracing?
We are. There's the state tracers are just as behind. If there was an easy answer out there, we'd do it. We tried to do as much of it as we could ourselves. And then along the way, we wanted to make sure we had local people calling local people related to positive cases. But then piece by piece, we've maxed out and given the state whatever we can. And we're there right now with all the help that is coming from them. It's still hard to get behind. And a lot of the state tracing is behind. So if you have a test that comes in later, and then you have a delay in the tracing, it makes it really difficult. But we're using all the help that we can get, but the state isn't in much of a better situation than we are.
With contract tracing behind, do you recommend people download and use the COVID Alert New York app?
I think I certainly couldn't hurt. I'm not an expert as to how effective it is. I still think the best weapon is just common sense and feeling what you're personally comfortable with. I think different people will take more risks depending on their health, the people that are around, and I think the biggest weapon that people need to use is common sense. And if you have reasons to need to take less risk in your life, then there's precautions that you can take. If you're someone that is younger, healthier, and you're around a lot of young, healthy people, and maybe you take a little bit more risk. But I'm not sure as to the effectiveness of the app, but certainly for the next couple months, I think this is the last hurrah of tough times. I think caution is a good recommendation at this point. Would you agree, Sheriff?
I agree. Even, you talk about wearing face coverings, and people say, well, there's no guarantee. You're right. A face covering is not a guarantee, but it decreases the percentages, right? Of the likelihood of you obtaining it. So if you just take the universal precautions yourself and respect others and try to keep yourself 6 feet away from others and wearing a face covering.
Washing your hands. Staying home if you're sick.
I mean, I don't have a medical degree, but I know the people that do, they continue to say the same thing. And it's shown to work here locally for some of us. And, it's proven that we can keep our numbers down. Yes, we're on the increase now, but we've done a great job all year long.
Yeah, and you know what? If the app can help, I think it depends on. I imagine it would depend on how many people are using it to its effectiveness, and I don't know the answer.
And if
to that
you
question.
have it downloaded, if you're positive, right? That's
Exactly.
the only way it's going to benefit somebody who's next to you.
Exactly. So I think we stick with the basics, and that's the best thing to do.
We use every tool in the toolbox.
Yeah.
If you want, download the app. Sure, can't hurt.
I'm certainly going to check it out now.
So Jess actually sent me a response to the question about the quarantine numbers.
Okay,
The changes in the number of people
yeah,
quarantined. She says the quarantine drop is because the week before some of our positive cases had large number of exposures because of holiday gatherings and working during contiguous period new cases this week didn't have as many people they exposed because staying home. That's why the number is lower.
okay,
If that makes sense
all right.
to you, but
So, but I think what she's saying is there was some pretty large
Close contact.
close contacts at gatherings, and when those came off, that caused a drop in the numbers. Thank you, Jess.
will school closures be reevaluated before January 3rd?
School closures are being evaluated almost daily. I can tell you that's been the big topic of discussion with the superintendents this week, and it is a gut-wrenching decision because they're doing everything they can. The data shows that, the schools are a safe place for the kids. We know that the kids need to be in school, but there's a lot of concerned people out there, and you're having logistical issues. If all your bus drivers go out, or you have all your nurses out, or it becomes a logistical problem to stay open. And then the question becomes, if you logistically can open, should you go remote? And I think the district certainly, we're keeping a close eye on it, but I know that they're trying to stay open, and it's very difficult. It's it's a lot of work for our public health department as well, but we've been communicating and evaluating that regularly. I think if we go yellow, that will kick in the testing requirement, and that would shift schools to all remote. So that answer might be made for us by the state in the near future. But for right now, I know that each superintendent is weighing that very heavily and in contact with us about what's going on, particular issues within their school. But when you look statewide and you look locally, we haven't seen really any widespread community spread within the schools. And the schools statewide have been shown to be, when they are tested, very low rates and a very safe place for kids because the protocols are being followed. So,
And they want kids in school,
exactly.
right? Our school superintendents want them
Yes.
in school, so they're doing everything they can to make that happen.
Yeah, and we're having very, very, heated discussions about the pros, the cons, and they're not easy decisions. That's for sure.
Any idea when vaccines will be available in Montgomery County? I called our doctor this morning and they said they have not heard anything yet.
Yeah, I mean, we're still in that very first wave of, the folks at the nursing homes and hospitals and things of that nature. I suspect before you see widespread vaccination, it's going to be, at least a month or two. But there is some information out there by the state, but I'm hesitant to say specifics until I know for sure. But I think we still have a little bit of time.
I think in last week's press conference with Governor Cuomo,
Mhm.
he said it could be potentially March, maybe April.
Yeah, it's going to be some time, and that's widespread. And then you also have related to the vaccines. Some of the polling it started out at 50% would take it. Now, the latest I've heard, it's up a little bit, and people are getting more comfortable with the idea. But the vaccination process to get to the point where we put this behind us is something that's going to take months.
This is kind of more of a statement, maybe to bring up to the superintendents. Some parents need more than 24 hours notice for school going full remote. Given Christmas, there's no reason to wait till January 3rd. Will you please update us before that?
Sure. Yeah, I think sometimes I would just say that I'm sure the superintendents would like to give more notice. They may have been notified, at last minute. Things are happening
Sometimes
quickly.
the contact tracing doesn't come in until 5, 6, 7 o'clock.
Yeah, or you get a positive cases in the late afternoon dump.
Saturday,
and, and then you got to go through and make the decision. So it's a challenging thing for sure. But I will certainly relay those thoughts, and I know that a few of them have been watched the briefing, so they probably heard that as well. In my discussions, it appears that they're trying to do the best they can. It's just a really, really tough situation.
Yeah, same thing. When I've talked to them, they're struggling every day because they want to do what's best for the students and the parents and the school district, and then they're getting pulled.
And there's a lot of varying, passionate opinions on all sides of this, so it's tough.
I'm not sure how much more can be done because there are many people who will continue to refuse to protect themselves, let alone protecting someone else. It's an uphill battle trying to get people to comply.
Yeah, I mean, there's certainly people are at the tail end of a pandemic and are sick and tired and frustrated. And I always say that people around here are very resilient, and strong, tough people, and we're going to get through it. It's going to be another couple tough months, but we just got to keep our head down, dig in, and keep going forward.
Just respect each other.
Yep.
That'll help.
Yeah. Yeah. I mean, like we said, limiting your gatherings and doing these things. If everybody pitched in a little bit, it'll make it a little bit easier. And I think there's people that aren't, but there also are a lot of good people that are.
Oh, yeah.
So you got to look at both sides.
Is the county going to follow CDC rules for the vaccine or Cuomo's? They don't jive.
We have not, I don't think, put out a vaccine policy as far as, these questions for our staff or just generally.
I think just generally the county.
Well, ultimately, the decisions about vaccines are going to be an individual decision. They're going to be, for employment reasons. I'm not sure they'll necessarily be a county policy, but, we'll follow state and federal guidance as it relates to public health, that's for sure. Yeah. I mean, I'd have to look and see what the specific difference is that they're talking about. The vaccine is going to be, that's even a hotly debated topic.
Can't a state of emergency be called by you with the numbers being so high?
Yeah, I mean, I can certainly do a state of emergency. Right now, given that we haven't even been put in the yellow phase, I don't necessarily think that now is the right time to do that. And looking at, what's going on with the hospital and the ability to treat, as well as, what people's experiences are as far as how sick they get. I mean, I don't think we're there right now. Should we get a yellow or an orange or even a red designation, maybe. But I personally am hesitant to get out in front of the state on, a state of emergency or restrictions on businesses or things of that nature. But, we'll see. I mean, we could have a yellow designation later today, tomorrow, Wednesday. And I think I feel comfortable with that. And I don't feel the need at this point to do a state of emergency.
I think we're all set.
We're all good? Any parting words, Sheriff?
We say it all the time. Just please be part of the solution,
Yeah.
not part of the problem. I mean, let's work on this together. And we're all frustrated, but, if we just have a little compassion and we communicate and we try to do the right thing, limit your gatherings, limit your numbers, be smart. If you have any gathering, be smart about it. Don't put us in a bad position.
Yeah.
That puts you in a bad position.
Exactly.
And let's get through it. We're almost there.
Yeah, and have some fun. And it's the holidays are a special time. I know, I have a 5-year-old, and we made a whole bunch of DIY soap, and we're giving it out to people for gifts. And sometimes I'm trying to focus on those little things and trying to be positive and do the best you can. And we're gonna get through it. But I hope everybody has enjoys themselves. They're safe and have a great Christmas, great holiday season, and take care. And hopefully, we'll see you next week. There won't be any major issues to report, and that'll be that. So take care, everybody, and Merry Christmas, Happy Holidays.
Thank you.